Well, the normal level is a couple of 100,000 a year, but it depends on the needs in the economy. And that's why the really important question is, if there are lots of vacancies in the economy, why have we got people who are out of work in the UK who should be able to access training and skills and access the jobs that exist in their local area? And that's why this is an abnormal set of numbers. It's an abnormally high number of work visas, especially into the health and social care system, which reflects problems in the way that the NHS is being run by the government.
And we've been discussing that already, and thank you for dealing with a slight delay on the line there, but you mentioned a couple of 100,000 as being a normal figure. So if Labour wins the election, should people then expect that you would be looking to set immigration levels at around about a couple of 100,000 a year as a normal kind of level?
Well, the Conservatives have tried to set targets and caps and failed every single year whilst they've had them. What we have to do is make sure that where there are problems, and the prime example here is the health and social care system, that we're getting to the root cause of the problem where we don't have sufficient labour availability locally here in the UK. And that's for two reasons in the National Health Service. One is because we need a proper NHS workforce plan, which my colleague Wes Streeting, the Shadow Health Secretary, has set out in detail. But the second is because we do need to improve the productivity of our public services so that they're more efficient, so that you don't need as many people in order to be able to run them. And that's why ultimately we're relying on a lot of overseas labour to come in and keep the show on the road. And we're very grateful for their contribution, but it's actually reflective of underlying problems in our public services that need modernising.